I was a nurse in a psychiatric hospital and progressed slowly over the years to general nursing, and then I was a midwife, and then I was a clinical teacher. The ultimate success of my career was as a director of nursing of a large hospital in Leicester. And I was fortunate enough to be around and have the opportunity to join what was called the National Programme for Information Technology. And from there on till now, I've given all of my available time and skills and effort to encouraging the use of good information. Clinical safety is going to be inherent in any service that one person delivers to another, is to balance what the technology can bring with an understanding of how the service would naturally function, trying to ensure that people see what they should see, that they read what's there, it's complete, they're not missing anything, that they don't have to scroll or turn a page where they might not do it, and that whatever calculations are made on their behalf, we have tested. If it wasn't joined together, you have inherent risks all the way through. If you don't have the right stock, or you have stock that's there for too long, it's out of date, if you don't have the right stock to put things together when they're needed, then the patient is going to have to wait. If you prescribe something that's not available, again, the patient waits. If you go on to administration and you don't have checks and balances in there, that the right administration time is there, that the right dose and everything's legible for you to do that, then there's inherent risk. There's risks all the way through. Once you separate things in any process of manufacture, you increase the risk. If you keep it all joined up, you can mitigate one risk by ensuring that the closure of this part of the process opens this part of the process. And all of that joined together is medicines management, because the effects of mistakes in medicine management can be, as we all know, can be, fairly significant. JAC having that integrated system, which includes both the pharmacy side of things and the prescribing and administration side of things, is an absolute advantage, because you can't just say that there could be an error in prescribing and that's a huge risk. There could be, if you don't have the drugs that you need when you prescribe something, there's a delay in care, and that is a recognised risk. And so it really starts with the selection of the drugs that your particular service needs. How do you purchase them? How do you get them? Where do you store them? How do you know they're being used? How efficient is your dispensing of those drugs to the places where they're most needed? It is not a one-person job. It's an organisational approach to believing that with the right type of focus and the right type of commitment, the whole business can make the product so much safer all the time. It's not saying it's not safe, but it continually can get safer and safer. I was fortunate to work in a hospital that had designed pathways for the patients who needed a hip replacement. And it took them a long time to design that pathway, but the pathway actually said from day to day what that patient should receive. It wasn't to take judgment away, it was to show that this had been proven to be the best and most effective way to care for that patient. And so the outcome is that patients go home sooner. So we have to kind of provide as much decision, they call it decision support. So we take good evidence of what works, and we try and steer people away from what has been proven not to work. From that, we make things more legible, more accurate, more efficient. Administration is better. We can see if we miss a dose, which is absolutely critical when patients are recovering. So I think there's any number of outcomes now that you could find that say that the actual application of good information does have a very positive outcome. The message that I'd want to get across is be safe and use everything that's available to you to be safe. And that will include your own integrity, your own knowledge and experience, but the use of technology as it is now and as it is evolving to support what you already know and do well, but that you can do better if you have something that backs up what you do.